Muli po ay magandang hapon. Pagpapatuloy po natin ang ating pag-aaral sa traditional Chinese medicine. Ang ating topic ay ang Jing essence. Jing essence. Jing essence. So, siya po ang responsible for essential immaterial soul and essential physical being, yung body po, of a person. Yin nature installed in kidney. Nasa kidney po siya, no? So, siya ay denses physical matter within body. Circulate through 8 major vessels, where it helps to create semen, menstrual blood, and bone marrow. So, yun po yung napakahalagang role ng Jing essence. So, ang Jing essence po ay siya yung nagre-regulate sa growth and development ng tao. Work with Qi to help protect body from harmful external factor. So, yung Jing plus Qi, yun po yung foundation ng ating Shen or spirit. So, ang Jing essence po ay, Jing is usually translated as essence, used in 3 different contexts with slightly different meaning. Pre-heaven or prenatal essence. Ibig sabihin naman na natin. Yung post-heaven naman po or postnatal essence. Ito yung mga kinakain na natin. The essence or kidney essence. Yun po yung mga meaning ng essence. So yung pre-heaven essence po, determine its person basic constitutional makeup, strength, and vitality. Can be influenced only with difficulty in the course of adult life. Pag post-heaven essence naman, in general term, to indicate the essence produced by the stomach and spleen after birth. Ito po yung mga kinakain natin. As opposed to the pre-heaven essence, which is formed before birth. Yung pre-heaven, ito yung mga manang enerhiya natin na nakalagay sa kidney. Pag post-heaven naman po, ito yung mga pag kinakain natin na nagiging Qi. Okay po. The essence or yung kidney essence derived from both the pre-heaven and post-heaven essence. So, pareho po yun from heaven. Interacts with the post-heaven essence and is replenished by it. Determines growth, reproduction, development, sexual maturity, conception, and pregnancy. So, doon po nakalagay yung lahat sa essence. Yung essence daw ay na re-replenish natin sa pamamagitan ng ating mga kinakain. Kaya kung hindi malusog ang ating pagkain, hindi na re-replenish yung ating pre-heaven essence, mauubos, mas mapapadali yung ating buhay kasi nauubos na siya eh. Yan. Function of essence. So, this is the basis for growth, reproduction, and development ng physical natin na katawan. Ito rin po yung nagpo-control sa growth of bones in children, teeth, hair, normal brain, development, and sexual maturation. Basis of kidney Qi. Siya din po yung nagpo-produce ng marrow. Tapos basis of constitutional strength. So kung malusog ang ating essence, malusog yung pangangatawan natin. Pero nare-replenish lang ito kung malusog din yung ating mga kinakain. Observation ng TCM, kidney essence, show in hair, teeth, bone, structure, ears. Yung great kidney essence. Yung pong yung mga namamana yan na nasa kidney. Not so great kidney essence. Yun, ang ganda ng teeth niya. Itong isa, hindi masyado. Kaya hindi daw great yung kanyang kidney essence. So pag healthy yung kidney essence natin, healthy din yung physical nating katawan, nakikita. Okay. So yun po yung ibig sabihin ng ating essence.
Thank you very much, Ma'am Mildred. So I'm sure marami tayong natutunan about the kidney essence. Okay, maraming salamat po. We will now continue with tongue diagnosis and let's listen to Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. Now let's talk about sublingual veins. The sublingual veins should always form part of a routine examination of the tongue body. Under normal conditions, the two veins under the tongue are barely visible, and they have a very faint pale red color. When they become clearly visible, they are by definition pathological. One should observe the size and the color of the sublingual veins. If the veins are distended but not dark, it indicates G deficiency, whereas if they are too thin in relation to the sides of the tongue and the patient's body itself, it indicates yin deficiency. The most important sign with regard to sublingual veins is their purple color. If they are distended and dark purple, it indicates blood stasis, usually in the upper burner, lungs, or heart. But it may also refer to the liver. Distended and dark sublingual veins are more common in the elderly, and they give an early indication of blood stasis before the rest of the tongue body becomes purple. So this is a tongue with a purple sublingual veins. Observation of the sublingual veins, therefore, has an important preventative value. Dark and dry sublingual veins indicate severe yin deficiency with empty heat. Dark, swollen, and wet veins indicate lung, spleen, and kidney deficiency with accumulation of fluids. Such observation is important also in chronic painful obstruction syndrome. If these sublingual veins are reddish and shiny, they indicate damp heat. If they are yellowish, they indicate dampness, while if they are white and slippery, they indicate cold dampness, and if they are swollen as well, they indicate dampness and blood stasis. In modern China, some doctors consider the appearance of sublingual veins as a useful prodromal sign of certain diseases. The main signs are as follows. Dark purple, it indicates hardening of the brain arteries. Distended dark and crooked, it is hardening of the arteries. Hypertension if the veins protrude a lot and look like earthworms. And this means the disease is severe. Small nodules like rice or wheat grains, it is hardening of arteries and heart disease. Distended sublingual veins but not dark, it is Qi deficiency. Thin sublingual veins indicates yin deficiency. Distended and dark, it denotes blood stasis in the upper burner. Dark and dry is severe yin deficiency with empty heat. Dark, swollen, and wet, it is lung, spleen, and kidney deficiency with accumulation of fluids. Reddish and shiny sublingual veins, it indicates damp heat. Yellowish indicates dampness. White and slippery, it denotes cold dampness. Swollen, white, and sticky denotes dampness and blood stasis. Sublingual veins in Western medicine. Dark purple, hardening of the brain arteries. Distended, dark, and crooked, it is hardening of arteries. And hypertension if the veins protrude protrude a lot and look like earthworms. In this case, the disease is severe. Small nodules like rice or wheat grains, it is hardening of arteries in heart disease. So same lang din sa TCM. Thank you so much for
So
listening.
Ma'am Tess, napakahalaga din tinitingnan natin yung ilalim ng dila, ano? Ngayon, alam
Ayun.
natin.
Opo.
Pag
Opo.
nagle-lessen na po yung color niyan, ibig sabihin gumagaling
Yes
na
po,
siya.
it has a great significance po.
Po.
Kumusta
Hindi lang
yung Yeah.
Hindi lang Doc yung body ang titingnan talaga, kailangan tingnan din
Oo
yung
naman. Mm. So, kumusta yung sublingual veins niyo, Ma'am Teresita?
Hindi ko pa nakita
Okay.
recently.
Ako maganda yung sublingual vein ko, Doc.
O,
Nag-improve
diba?
na. Nawala na yung purple. Dati purple eh.
Ganda, no?
Lagi ko pong ina-acupuncture kasi yung deficiency eh. Ngayon po, halos wala na.
Very good. Congratulations. So, kailangan
Ano
tayo
pala, Doc?
Mm-mm.
Purple pala, Doc, but not distended.
Okay. Okay.
Pressure mo ate, i-pressure mo, makakatulong din yun, yung mga points.
Acupressure. Sige. For diagnosis by interrogation, andito pa rin tayo sa feeling of cold. This time, we will talk about internal fever. By fever is meant the situation when the patient has a fever but no simultaneous cold feeling or shivers. So now we are discussing interior fevers. So which may be of external or internal origin. So an internal fever na may external origin is one caused by exterior pathogenic factor like wind heat, wind cold, or damp heat, which has penetrated into the interior and caused a fever. An internal fever of internal origin stems from kung meron kang internal disharmony like interior heat, yin deficiency, chi blood deficiency, and blood stasis. Okay? So here we have the relationship between external pathogenic factor and interior fever. So if we have an external pathogenic factor, first, it will cause exterior fever. Then pagpasok niya, it will become interior fever. That means yung pathogenic factor nag-penetrate na po sa interior. Then here we can see the external and internal causes of interior fevers. So example of external cause of disease is external wind. So pathogenic factor will penetrate in the interior. This will cause interior fever. Meron din tayong tinatawag na internal cause of disease, which is due to your disharmony, example, yin deficiency. This can also cause interior fever. In some of the patterns discussed, there may not be an actual fever. Actually, ang meaning ng fever po sa Chinese is just a feeling of heat. The pathology and pathogenesis of internal fever or feeling of heat is the same. Acute fevers, there is an actual fever. So ibig sabihin, raised body temperature, whereas chronic fevers may feeling of heat lang without a rise in body temperature. So importante dito yung feeling of heat, katulad ng nararamdaman ng mga tao. Okay, contrary to the situation in exterior syndromes, when fever indicates an objective hot feeling of the body, in chronic interior syndromes na may fever of internal origin, fever may indicate a subjective feeling of heat. So we have 3 degrees of fever or hot body sensation. First is slight fever. Indicates that the fever is very low, body is only slightly hot. Patient may not be aware of having a fever. Diba there was a time talagang tense tayo pag may fever tayo. Okay, so fever indicates that the body temperature is raised or the body feels quite hot to the touch. The patient is aware of the fever, meron na po siyang feeling of heat. And the last one is strong fever. Indicates that the fever is very high. and napaka-hot po ng body to the touch. Meron pong intense feeling of heat ang patient and throws off bed clothes. Okay? So when discussing fevers of internal origin, it is important to differentiate between acute and chronic fever. And we shall discuss this next time. Thank you very much, everyone. If there are no questions, we can proceed to pulse diagnosis. Let's welcome Ma'am Mildred once again. Good
Yes,
afternoon po, Ma'am Mildred.
Good afternoon po muli. So, false diagnosis po tayo, number 76, right front position. Ito po yung sa lungs. Right front position, ang makakapa po nating organ ay para sa lungs. Upper left, lungs. Pag medial po ay thorax. Pag lower left wing ay diaphragm. Pag lower left lung, pag lateral thorax, pag upper right lungs. Yung pag nilagay po natin yung mga kamay natin, yan yun ang mga makakapa. So yun po yung structure of right front false position. Okay. The right front position reflects the state of the lungs. It should be remembered that the lung false is naturally quite soft, and this should be taken into account when identifying a particular pathological quality, especially a full type ones. In other words, a tight or wiry or slippery quality of the lungs pulses is less obvious than in other positions. Thus, a quality that might be considered slippery or tight in the lungs pulse may be normal for other pulse positions. The right front, yun pala. The special lung pulse position, tapos na po tayo dyan, di ba? Tapos na tayo, Dok. Okay. Special lung pulse, ito po yung arteries, yung makikita natin yung blue. So, doon natin pinapatong yung ating kamay. Yun yung distal and medial location. So, para po siya, doon sa may thumb fingers natin. And dyan natin nakakapa ang lungs. Wow. The right front position reflects the state of lungs. It should be remembered that the lung pulse is naturally quite soft, and this should be taken into account when identifying a particular pathological quality, especially a full types 1. In other words, a tight or wiry or slippery quality on the lung pulses is less obvious than in other positions. Thus, a quality that might be considered slippery or tight in the lung pulse may be normal for other pulse positions. Balik siya ulit. When feeling the lung pulse, we should also check a position distal and medial to it, which Dr. Shen calls the special lung pulse, figure 50.6. In normal condition, there is no pulse in this position. If the special lung pulse is present while the lung pulse itself is weak, it indicates that the person had a lung disease as a child or that his or her parents had a lung disease, possibly TB or lungs, and that this factor have adversely affected the patient's lungs. If a special lung pulse can be felt, but the lung pulse itself is normal, it indicates either that the patient suffered a lung disease during childhood. Diba yung nagkaroon siya ng whooping cough or nagkaroon siya ng pneumonia, or that his her parents suffered from lung disease. So example, yung TB of the lungs. If the special lung pulse is soft and the lung pulse itself is normal, it indicates a past problem in the lung. If the special lung pulse is floating, it indicates a present problem in the lungs. Sa pag-soft ay yung nung nakaraan, yung mga magulang o nung bata pa. Pero pag floating, kasalukuyan po yun na may problem yung iyong lungs. Halimbawa, pwede meron kang asthma or TB. So, if the special lung pulse is slippery and the lung pulse itself is normal, it indicates retention of old phlegm in the lungs kasi slippery pag naramdaman mo yung slippery. If the special lung pulse is slippery and weak, and the lung pulse itself also is weak, it may indicate TB of the lungs. So pag very weak yung pulse, pwede pong merong TB pa ang baga. Pag floating naman, a floating quality on the lungs position is very commonly seen in invasion of external wind. Yan. Pag floating external wind po yung ating, yung pathological na pumapasok sa katawan. So if the pathological factor is particularly strong, the pulse will be floating in all position. So kahit saan mo ikapa, floating po ang mararamdaman nyo. Ibig sabihin, mas malakas yung pumapasok na pathological wind. A floating tight quality on this position indicates invasion of wind cold. Floating tight with prevalence of cold. A floating slow quality indicates invasion of wind cold. So basta floating is slow, wind cold. With prevalence of wind. And floating rapidly quality indicates, so invasion po yun ng wind heat. If the pulse in this position is floating but weak, so indicates na yun nung nakaraan daw ay may invasion of wind and retention of residual pathogenic factor in the interior. Ibig sabihin, hindi pa nawawala lahat yung pumasok na wind sa katawan. So floating and weak ang makakapa natin. So if it is floating, hollow and soft, it indicates stagnation of chi in the lungs from emotional problem. So, yun po yung mga pagkakaiba. Pag slippery naman, ang makakapa natin sa lung position, so indicates phlegm in the lungs kasi slippery, sign of phlegm. Pag overflowing, so sa lung position, nagsasabi ito na may init ang baga. Yung overflowing, pinag-aralan natin na pag kinapa mo, nararamdaman mo agad na pakalat yung mga ano niya, yung galaw. So, in the absence of heat signs, a relatively overflowing quality in this position indicates emotional problem deriving from grief or worry. Kasi alam naman natin yung grief, yan yung emotion ng lungs. So, hollow, a hollow quality with strength indicates that there might be bleeding in the lungs. Yung pag ano po ano, yung hollow ang mararamdaman. If it is also rapid, it indicates a forthcoming bleeding in the lung. Forthcoming bleeding in the lung. So, madidetermine natin. So, right front position naman ng lungs, pag floating po, lagi nating tandaan, pag floating ay may invasion of external wind. Pwedeng wind cold. Pag wind cold ay floating tight. Pag wind heat ay floating rapid. Yan ang pagkakaiba nila, no? Pag cold tight, pag heat rapid. Tapos nagka-invasion of wind heat, floating rapid, residual pathogenic factor, pag hindi pa nawala sa katawan natin, ang mararamdaman natin ay floating weak. Pag may stagnation naman sa lungs, dahil sa emotional problem, ang mararamdaman natin ay floating, hollow, and soft. So pag slippery naman, syempre may phlegm sa baga. Pag overflowing, may lung heat. O dahil sa emotional problem mula sa iyong pagkalungkot at pag-worry. Pag hollow, tandaan po natin ay bleedings in the lungs. Thank you po.
Thank you very much, Ma'am Mildred. Okay, from Paul's diagnosis, let's proceed to differential diagnosis. Let's listen to Ma'am Teresita Sumilen for her discussion of liver fire insulting the lung. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector, and good afternoon din po again to my classmates. Liver fire insulting lungs. Etiology, repressed anger and frustration, excessive consumption of hot and greasy foods. Underlying accompanying pathology, we have liver qi stagnation, lung qi deficiency, spleen qi deficiency. And then we have also signs and symptoms: breathlessness, asthma, fullness, stuffiness, scorching pain of chest, and hypochondrium, cough, yellow or blood tinge, scant, sticky sputum, rashness, impatience, headache, dizziness, red face, thirst, bitter taste, scant, dark urine, and constipation. Ang pulse po niya ay wiry, slippery, and rapid. Tongue is red, redder on sides, dry, yellow fur, swollen in lung area. Treatment principle is clear, heat, and drain fire, moisten lung, and transform phlegm. Acupuncture treatment: use bladder 13, regulates lung qi, liver qi, clears liver fire. Liver 3 curses the liver. Liver 14 harmonizes liver qi and the chest. Ren 22 descends lung qi. Lung 7 descends lung qi. Lung 10 disinhibits the throat. GB 34 soothes vessels. LI 11 clears heat. Ren 17 descends lung qi. And PC6 opens chest and descends lung qi. Needling technique is with drainage. Thank you so much for listening.
Thank you very much, Ma'am Teresita. So we will now proceed to acupuncture patterns and practice. And today we shall take up a very, very relevant concern: depression. Okay. Depression is a condition brought about by pent-up passions and impeded qi movement. So kahit saan ka pumunta, meron pa ring qi. In addition to the pent-up emotions, it manifests mainly as emotional lability, chest fullness or tightness, subcostal distension or pain, and globus hystericus. Etiology and pathology. The passions are the primary causative factors in depression. When the regulation of the emotions becomes impaired, affected po ang ability of the liver to disperse and transport. And also the heart's ability to govern the mind become compromised. So heart and liver are affected. Whether or not this loss of regulation actually leads to illness will depend upon a number of factors. Okay. These include the state of the organic body, as well as the degree of severity and duration of the emotional imbalance. For example, a patient with a chronically high level of liver activity is more prone to illness on being emotionally frustrated. If the object of prolonged brooding or planning is unattained or pent-up rage is unreleased, the liver loses its smooth functioning, and so there will be liver qi stagnation. So there will be chest and subcostal distension and pain. Now, liver qi stagnation can transform into fire. If the liver fire is persistent, this will obstruct the meridians, and this will lead to stasis of blood. If stagnant qi transforms into phlegm, the blocked liver injures the spleen, or there is excessive brooding and anxiety, then the spleen loses ability to transform and transport, so that dampness accumulates, and so there will be phlegm. So this results in an illness of phlegm accumulation and qi stagnation. Intermixture of stagnant qi and phlegm blocking the throat gives rise to globus hystericus. If heart and spleen qi become chronically stagnant, there will be anorexia, so that the sources for the generation of qi and blood become reduced. This will lead to two varieties of illnesses. No, it can lead to poor nourishment of the mind, which produces the so-called visceral restlessness. So this is actually emotional lability with proneness to sadness, worry, and weeping. Or it can lead to illness of deficiency of both qi and blood in the heart and spleen. If gelled fire persists and damages the yin, the patient will develop an illness of yin deficiency of the heart and the kidney, or blazing fire. In depression, the main visceral organs affected, so we should all remember this, no, are the liver and the heart, but other organs may become involved, like the gallbladder, the spleen, stomach, lung, kidney, the brain, and in females, the uterus. Okay. In its initial stages, depression is an illness of strength caused by pathogenic factors, so excess siya. Pathology is principally qi stagnation, but this can involve blood stasis, the rise of endogenous fire, gelling of phlegm, or food retention. If it persists, it evolves from an illness of strength to one of deficiency. Because many visceral organs may become affected and the injuries to qi, blood, yin, and yang may differ. Depression can have a variety of symptoms related to the heart, the spleen, the liver, and the kidney. Heart, spleen, liver, kidney. Clinically, strength and deficiency may become intermixed, and it is common for the illness after the initial stages to become one of deficiency of qi, blood, yin, or yang. So let's now go to clinical manifestation. The principal clinical manifestations of depression are those of qi stagnation, such as pent-up and unstable emotions, and chest and subcostal distension and pain. If other stagnation develops, there may be other corresponding symptoms. For example, if there is blood stasis as well, then the patient may show distending or stabbing pain in the chest and flank. Fixed location. Tongue is cyanotic with ecchymosis or petechiae. If there is gelling of fire, so the patient will be impatient, irascible, may chest tightness, subcostal pain, acid regurgitation, dry mouth with bitter taste, constipation, red tongue with yellow coating, and a taut and rapid pulse. If there is food retention, there will be gastric distension, foul eructation, and anorexia. If there is accumulation of dampness, there may be heaviness in the body, abdominal distension, eructation, a greasy mouth, loose feces, or diarrhea. If there is gelling or phlegm, there may be abdominal distension, a sensation of a foreign object in the throat, and a greasy tongue coating. If there is deficiency as well, there may be symptoms associated with the specific deficiency. In the case of visceral restlessness, there is absent-mindedness, emotional lability with unpredictable sadness, weeping or laughing, or globus hystericus. These symptoms are of great significance in the analysis of symptoms and in diagnosis. Depression, most commonly seen in young and middle-aged women. Most patients have history of melancholy, anxiety, sorrow, or fear. The waxing and waning of the symptoms of depression are intimately related to the vicissitudes of the emotions. Do we have any comments? Anything, Ma'am Mildred?
Doc, yung mga taong perfectionist, yun, madalas makaranas din ng depression, ano?
Ah, yes. Kasi napuprostrate sila. Opo.
Opo. Tapos yung mga nagmi-middle age po, syempre lalo po sa kababaihan, pag nagme-menopause na, ayan, nakakaranas din po ng depression.
Yeah, kaya kailangan talaga, people will look at acupuncture as a lifetime thing. So
Opo.
magtulungan po tayo to disseminate, no, the the news na kailangan po balancing. So
Opo.
if possible twice a month.
Kasi
So
kung napapalakas na yung organs, mas maiiwasan po nila yung depression. Kasi ang
actually,
pinakamalala, Dok, kung yung depression lumala at saka mawala na nga
oo.
sa sarili.
Kasi sa totoo lang, pag may problema yung organs mo, magkakaroon ka talaga ng depression. And pag may depression ka dahil sa emotions, magkakaroon ka ng problema sa organs. Ganun lang po yun. And this is
Pero
something
minsan, Dok, hindi alam ng mga tao bakit sila naiinis, ba't sila nadidepress, may mga ganun. Kasi may nakausap ko, sabi ko, ano bang problema mo? Sabi niya, nag-undergo ako sa depression.
mm-mm.
Tapos, sabi niya, ba't kaya ako biglang naiinis, hindi ko maintindihan. Sabi niya ganon. Kaya talagang
So,
mahalaga kung nakakausap po natin, ipapaliwanag tulad po nitong lecture natin ngayon, ipapaliwanag sa
totoo.
kanila anong nangyari.
Mm-mm. Kaya nga, sana po, people see this as very concerning ko talaga pag depressed. Sa
Bali,
totoo.
paparinig ko ito, Doc, na ating YouTube doon. Kasi hanggang
Si-
ngayon, depression eh.
Oo. Actually, I invited somebody, si Ma'am Shakil, to give us a lecture on, kasi psychologist siya, sa July yata. July, yan. Yan. Okay, so let's go now to signs and symptoms. Let's listen again to Ma'am Mildred.
Yes po.
Oo, nasa tooth cavities na rin tayo ngayon. O, diba? And loose teeth.
Opo. Sign and symptoms, number 69, tooth cavities, loose teeth. Mga nawawala na ng ngipin. Tooth cavities. So, pag damp heat in the stomach ang dahilan nito at saka spleen, ang tooth cavities, especially po sa lower teeth ang nagkakaroon ng sira. Kanina, di ba colon sa taas, pag stomach and spleen, sa baba naman ng mga ngipin. So, nagkakaroon po ng bleeding gums kasi damp heat eh. Tapos yung lips po niya ay red. Tapos, thirst with no desire to drink. Sticky taste, a feeling of fullness and pain of the epigastrium and lower abdomen. Tapos po, poor yung appetite, a feeling of heaviness, nausea, nagkakaroon din ng loose stool with offensive odor, a feeling of heat, dull yellow complexion. Pag tinignan natin ang tongue ay mapula with sticky yellow coating. Pag hinawakan natin ang kanyang pulse ay slippery rapid pulse dahil dampit ang nasa stomach and spleen. Okay. Pag stomach and spleen naman po ay Chi deficient, ang tooth cavities po, nawawala yung mga ngipin, loose teeth. Tapos nagkakaroon ng poor appetite, slight abdominal distension after eating. Madaling mapagod, then there is lassitude, yung mga pale complexion, yung panghihina ang kanilang mga kamay, loose stool, uncomfortable feelings in the epigastrium. Tapos lack of taste sensation. Ganun din po pale yung kanilang tongue at pag hinawakan mo ang pulse, halos wala kang mararamdaman, empty pulse. So, yung mga naubusan na ng ngipin. Pag dampit naman sa large intestine po, ang dahilan ng tooth cavities, ang nangyayari po, especially the upper teeth, so, thirst with no desire to drink, large mouth ulcers, tapos may abdominal pain po siyang nararamdaman, at hindi to nawawala kahit siya ay magdumi. So, nagkakaroon ng diarrhea, may mucus po sa blood, may mucus and blood sa stool, offensive odor of stool, burning in the anus, scanty dark urine, fever, sweating does not decrease the fever, a feeling of heat, so feeling of heaviness of the body and limbs, red tongue with sticky yellow coating, slippery rapid pulse. So basta dampit po, tandaan natin may heaviness, may sticky, may slippery. Yan po. Pag kidney deficiency naman po ang dahilan ng tooth cavities, so nawawala yung kanilang mga ngipin, naglulus teeth, lower back ache, nagkakaroon ng lower back ache, dizziness, tinnitus, nanghina yung mga kanilang knee. Other symptoms and signs include those the pulse and tongue depend on the whether there is kidney yin or kidney yang deficiency. Okay. Pag stomach ache naman po ang dahilan ng loose teeth, so may toothache siya, nagkakaroon ng mouth ulcer, tapos uhawin, may full breath, burning epigastric pain, sour regurgitation, meron siyang nausea, tapos nakakaramdam ng excessive hunger. A feeling of heat, yung kanya pong tongue ay red with yellow coating, tapos ang pulse niya ay overflowing rapid pulse. Pag kidney deficiency naman, ang dahilan ng loose teeth, so nagkakaroon siya ng lower back ache. So dahil andun yung sa ano ng kidney natin. Then nahihilo siya, nagkakaroon ng tinnitus, tiredness, tapos yung pulse niya ay weak, both rear position. Ang other sign and symptom depend on whether there is a kidney yang or kidney yin deficiency. Yeah. Pag spleen yin deficiency with empty heat naman po, ang nagiging dahilan ng loose teeth ay nagkaroon ng toothache, red cheeks, poor appetite, poor digestion, retching, groaning hunger, tapos loss of taste, slight epigastric pain, dry yung mouth at saka lips, dry din yung stool, thin body, mapapayat, tapos sallow complexion with red tip of the nose. Sa gabi ay nagkakaroon ng sweating, feeling of heat in the evening, red tongue without coating and transversal crack on the side. Ang kanyang pong pulse ay empty and rapid. Floating, empty, and rapid. So yan, spleen chi deficiency. Pag kidney deficiency naman with empty heat, ang loose teeth po ay nahihilo siya, nagkakaroon tinnitus, vertigo, poor memory, hardness of hearing. Sa gabi din may night sweating. Nagda-dry mouth din po. Tapos yung pied palm heat. Tapos a feeling of heat in the evening. Malar flash, menopausal hot flashes. Nagkakaroon siya ng uhaw with a desire to sip fluids. Tapos may lower back ache po yan, ache in the bones. Nagkakaroon ng nocturnal emission with dreams. So, may constipation, ang ihi niya ay scanty, dark. Then, pwede rin magiging infertility, premature ejaculation, tapos tiredness, depression, anxiety, insomnia, pag ang menstrual bleeding po niya excessive. Pag tinignan dila ay red without coating. Ang pulse po niya ay floating, empty, and rapid pulse. At hindi ito pag kidney deficiency. Hirap pinakyaw din niya lahat.
Yes. Pag medyo maedad na, no?
Opo.
Thank you very much, Ma'am Mildred. Okay, if there are no questions, we will now continue. We will now go to the last topic, but not the least. And let's listen to Ma'am Teresita, still on asthma. This time, she will discuss the liver and asthma. Anong relationship ng liver sa asthma? Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Let's now talk about the liver and asthma. The liver is also involved in the pathogenesis of asthma, especially in the late onset type. In early onset asthma, emotional stress affecting the liver can often be a triggering factor for an attack. The liver can play a role in the pathology of asthma in three possible ways. Number one, stagnant liver qi may rebel upwards in the chest and obstruct the descending of lung qi. From a 5-element perspective, this is called wood insulting metal. Second, liver fire may also rebel upwards in the chest and similarly obstruct the descending end of lung qi. This is called wood insulting metal. In addition, liver fire may dry up the lung fluids. Third, deficient liver yin may fail to nourish the kidneys, and this may lead to the kidneys not grasping it. Furthermore, a deficiency of kidney yin may lead to dryness in the lungs. So this illustrates the relationship between kidneys, liver in asthma. Stagnant liver qi derives from emotional problems such as repressed anger, frustration, and resentment over a long period of time. After some years, stagnant liver qi may easily turn to liver fire. Liver yin deficiency may also derive from emotional problems such as sadness. In addition, in women, it may be induced by childbirth and overwork. The three main liver patterns affecting asthma are, therefore, first, liver qi stagnant insulting the lungs. Second, liver fire insulting the lungs. And the third, liver yin deficiency. Liver qi stagnant insulting the lungs. Clinical manifestations are asthma attacks elicited by emotional stress, a feeling of oppression and distension of the chest and hypochondrium. The tongue body may not change in color except in long-standing cases when the sides might be red and the pulse is wiry. Treatment principle, we soothe the liver, regulate qi, restore the descending of lung qi, and calm the mind. Acupuncture points used are spleen 4, spleen 6, liver 14, bladder 18, gallbladder 34, fren 17. Needling technique is reducing or even method. Spleen 4 and pericardium 6 in combination open the penetrating vessel, relieves fullness in the chest, and subdue rebellious qi in the chest. In addition, pericardium 6 calms the mind and indirectly moves liver qi, as the pericardium and liver channels are connected within the terminal yin channels. Liver 14 and bladder 18 as front collecting and back transporting points of the liver, respectively, move liver qi. Then gallbladder 34 moves liver qi, fren 17 moves qi in the chest and restores the descending of lung qi. These points are in addition to those mentioned above for the various types of deficiency of lung and kidneys, defensive qi systems. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Okay, we're very happy because maraming natutunan yung ating mga students.